Welcome to the Saving Lives podcast. I'm Eddie Joe. Today is the 22nd of December of 2024, and we're going to be discussing fun sepsis order sets. Well, I know that's not that much fun, but I thought this article was interesting. I'm getting ahead of myself already. And this article was published in just last month, November of 2024, and it is titled Sepsis Order Set Use Associated with Increased Care Value. As always, this is not medical advice. I recommend you read these data for yourself. And as always, hat tip to the authors because they're out there doing some cool research and I'm not doing that much of that. Before we dive into this article, quick plug for my book, the Vasopressor Inotrope Handbook. Thank you very much to everybody who's picked up a copy. If you haven't picked up your copy, it's available on Amazon. Or if you click in the show notes below, on my Shopify account, you can save 10% by using the code podcast at checkout. So thank you again for your support. Now, some key things about sepsis and some things that are mentioned in this article include the fact that, as we all know, sepsis is a major cause of hospitalizations in our country. And from a cost perspective, it costs Medicare over $45 billion annually. Not million, but billion. And we look at the Surviving Sepsis campaign and user guidelines to help us manage patients and, their order sets. We can have conversations about what parts of the order sets we like and which parts we don't. Like, for example, the arbitrary 30 cc's per kilogram on everybody. Yeah, let's not go down that pathway. But nonetheless, there's still some questions that we have about this order set, and that's what these authors attempted to figure out. They wanted to see if these order sets improved care value and if it reduced hospital mortality, if it decreased hospital costs, and also lower societal spending on hospitalizations. So what did these authors go ahead and do here? Well, first of all, this is not a prospective study. It's a retrospective cohort study. And it was conducted across 51, that's a lot, of acute care hospitals in the Providence Health System. The amount of patients is pretty big that they looked at, 97,249. And these patients were diagnosed with sepsis over a 2-year period of 2021, and 2022. Now, what they measured was hospital mortality. They also measured direct variable cost and what they call payer-neutral reimbursement, which is a proxy for hospital revenue and societal costs. These are all things that are kind of foreign to me because I just want to take care of patients. But that being said, I have to see these sepsis order sets all the time, so might as well see if they're useful or not. And then they went ahead and propensity matched these groups between those who received the sepsis order set and those who didn't on a 1-to-1 ratio. So they matched these patients based on their age, their SOFA scores, their lactate levels, and other characteristics. So let's talk about results. This is what we're here for and why we're listening to this podcast. First and foremost, mortality. Now, they did see that the sepsis order set did reduce hospital mortality by 3.3%. So that's a good number. It's something. At least it's not nothing. At least it didn't increase mortality. From a cost perspective, they did reduce median total hospital cost by $1,487. So let's just call it $1,500 for those that were using the order set. Now, they also increased the revenue on these patients, or the contribution margin is the terminology they used. Again, this is foreign to me, by about $1,000 per patient, which indicated better financial outcomes for hospitals. So I'm guessing this is why they're being so stringent on us to go ahead and implement this. Now, they did have some secondary findings, and I think that this is the key point in this article, because I'm not an administrator and I'm not looking at costs, I'm looking at patients. There is a table which I'll probably go ahead and share here at this time, but in everything that had to do with antibiotic administration, it was faster in the group that had the order sets. So one of the better things, should I say, supported by data with regards to sepsis management is fast antibiotic administration. And that's something that the order set is excellent at doing. It's funny that amongst all the comparison of the groups, they did not share the values or the numbers as to how much fluids these patients got if they were in the order set group or if they didn't. But whatever, that's a different nitpicky story, or me just nitpicking this article. And they found that the most pronounced benefit are in patients that we end up seeing in the ICU, and those patients with septic shock, where they had a 6.4% lower mortality rate. From an economic perspective, um, these order sets saved the hospital system as well as society, I guess, because this is largely paid for by our tax dollars. So there are some economic benefits to this, and as well as the fact that since it's integrated, these order sets are integrated into our EMRs. They streamline workflows. They ensure that these patients are getting their antibiotics on time, as well as trending lactates, which I have my opinions on that, as well as earlier administration of vasopressors. So this is all in all something that's positive and something that reinforces the reason why we are having order sets bombarding us at our respective hospitals. But this also does have some limitations because it is a retrospective study, so it limits causality. And then it's, focusing more on acute hospitalization costs. But I guess that's what they were trying to do. And this is strictly evident based on the system in Providence, so we don't know if it's generalizable, but then again, I think that's too nitpicky. I think the key takeaway point here, if I'm going to wrap up this podcast a little bit soon, because I haven't been going for too long, is that there is utility for the sepsis order sets. In fact, I think there's a lot of utility for any order set for that matter, because it just bundles up everything that you need to do. The key component, however, of the order set, in my opinion, and as demonstrated by the table that I'm going to put down in the bottom right now, is the fact that the key difference of what patients received in the order set versus not in the order set was earlier antibiotics. So there's one thing to take away from this, it's that. And along those lines, I hope you guys have been enjoying a little bit more frequent content from me. I think I've found a better way to read and write podcast scripts. Thank you so much for joining me along in this fantastic roller coaster that I'm on. And again, if you haven't purchased a copy of the Vasopressor Inotrope Handbook, please go ahead and do so. It's greatly appreciated. I'll definitely sign it for you and personalize it for you. And of course, Merry Christmas, and I wish you all a very, very happy New Year. Thanks so much, guys. Have a great day.